Hi, everyone. I'm super excited to be back again today with Dr. Katie Lee. We're answering your real-life questions that you've sent in at asktheeggwhisperer.com, and I love that this community keeps the questions coming. We got some really great questions. You guys are curious, you're brave, and you want answers, and that's what we're here for. So I'm going to bring Dr. Lee up right now. Some of them are really fun questions, so I'm really curious to see myself what Dr. Lee has to say about them. I hope you guys are all having a great Wednesday. And some of these questions will make you blush, maybe a little bit. Hi, Dr. Katie Lee. How are you today?
Hi. I'm good. How are you?
I'm doing great. So for people joining us who weren't here last week, just kind of share a little bit about yourself, what you do, your clinic information, and then we'll just get right to these questions because we have so many to go through.
Sure. So I am Dr. Katie Lee. I am a holistic and integrative functional dentist, which is a mouthful, and my clinic is called the Collective Health Society. So we do holistic dentistry and functional medicine based out of Centennial, Colorado, and we really specialize in optimizing the oral microbiome, especially as it relates to women's health.
Yeah. And you have a particular interest in helping my patients, so I want to say thank you so much. And I get goosebumps talking about what you do, just like I get goosebumps talking about what I do. Okay, so here we go. First question from Christina, 40 in Romania from YouTube. What habit do I need to have to support my fertility? How can I support my dental and hormonal health? So what do you say, Dr. Lee?
I would say the best way to support fertility and hormonal health is definitely just making sure that you have a great microbiome. People are going to cringe when I say this, but flossing or water picking is really the best thing that you can do. The gum tissue is what houses the blood supply, and the gum tissue is in between the teeth. So if you're only brushing your teeth, you're missing the two most important surfaces of the teeth that house the blood supply and is responsible for the bacteria getting from the mouth into the rest of the body. So if you do nothing else, make sure that you floss or water pick. Either one is fine.
Okay. I mean, there are things that make me cringe. That doesn't quite make me cringe.
I think people are just like, really? That's it? Like, that's what I should do? Yeah. Yeah.
No. Okay. So this question comes from Nora, 38 from Australia. Hi, doctors. Thanks for sharing your knowledge. Should I be worried about having dental x-rays anytime close to an egg retrieval? What do you think, Dr. Lee?
So I would say that the amount of radiation that we have from dental x-rays right now, especially if your dentist is using digital x-rays, which pretty much every modern day dentist is actually really low. It's a lot lower than carrying your cell phone in your pocket, which a lot of people do all day long, even during fertility treatments. It's much lower than having your laptop around. So it's really, really low. And what's critical is that we honestly cannot see in between the teeth, which is where decay is, unless we have x-rays. So they are totally safe. I am a holistic dentist. We only take them when we need, but the amount of radiation is so low, in fact, that in my clinic, the machines that I have, we don't even have to have special backing in our operatories because the radiation is that low. So I would say, if they're used appropriately, it's really critically important to get them before you get pregnant because we want to make sure that we can catch any sort of lingering infections or cavities and treat them beforehand. It's much safer than when you're pregnant. So I would say not to be worried about it as long as you're shielded with a lead apron.
Great. Beautiful. Okay. Next question comes from Paula, our producer.
Oh, good.
Can your pillow or pillowcase change your oral microbiome? And what about using someone else's pillow? What if your dog likes to lick your pillow? I don't know why, but I'm both grossed out and obsessed by this idea that a dirty pillow might be a reason that someone's microbiome isn't an optimal condition for fertility or give them digestive issues.
Yeah, I would say that I don't quite know the answer. I don't know any research on this topic. I will say that unless your mouth is open and you're breathing into and out of the pillow, right, and transferring microbes that way, I personally wouldn't see how it would affect your oral microbiome. So while it's kind of gross using someone else's pillowcase or, having a dirty pillowcase, might be bad for your skin and your hair. But in terms of oral health, I don't really think it has that much of an impact. I could be totally wrong, but I don't know of any recent research on that.
I think you're right. Okay, this one might be a little cringy, but in my world, we talk about this kind of stuff all the time. This is Anna, 37 from Stockton. Her question is, this might be awkward, but can oral sex during foreplay cause any issues with the oral microbiome that could affect fertility? Does it make a difference if it involves the male or female parts that are in someone's mouth?
Yeah, that's actually a really good question because it does take two to tango, right? So whenever I'm talking about optimizing people's oral microbiome, especially for fertility, I say we have to test both partners because, you got to get down and dirty, right, in order to make a baby. So I would say like the bacteria in the mouth are different from the bacteria that's part of the genitalia. And as long as you are overall pretty healthy and your oral microbiome is pretty robust, any kind of transient microbiome shift from oral sex is going to be pretty temporary. The best thing that someone could do afterwards is, of course, rinse the mouth, brush the teeth. Tongue scraper is great, but as long as they're generally healthy, it's not something I would worry about. However, if there's something like a virus, like HPV, right, or herpes simplex, or something like that going on, then I would definitely be concerned. But I think overall it's pretty temporary, but definitely encourage them to do some oral hygiene practices afterwards.
Got it. So we can't use, oh, my oral microbiome is going to be impacted as a way of not doing oral sex. I'm just kidding.
You absolutely can. I can give you, yes, the note from the dentist that says you're not allowed to do this, especially while undergoing fertility treatment.
Okay.
I mean, women go through enough. I feel like they should get a break,
Yeah, I agree. And I was interrupted, so I want to ask her that question again as soon as she joins back. There she is. Okay.
There we
I'm
are.
not sure what happened there, but we'll ask that question again about toothpaste for mouth health that also supports fertility for those who were listening and then we cut off. I've heard sodium lauryl sulfate can be harmful, but I also feel like the bubbles make toothpaste seem like it's working. Is something natural like Tom's actually safer? And we're talking about fertility and toothpaste right now.
Yeah, so we definitely want to stay away from most of the mainstream companies when it comes to oral healthcare products. They have very toxic levels of chemicals in them, sodium lauryl sulfate being one of them. That's the foaming agent, fluoride, all those things. And there's much better alternatives on the market that are proven just as effective. So something with like a micro nano hydroxyapatite is really great to use instead of fluoride. Something with arginine, like Tom's. Tom's has a high arginine content. That's actually really effective against tooth decay and great for sensitivity. I totally understand when they're like, you need some bubbles to make sure it feels like it's working. And that's one of the main complaints with natural toothpaste is you just don't feel clean and fresh afterwards. I've tried as many as I can find on the market. I love, love, love Wellness. It's a really great company that I found. They are mommy founded. So it's a woman who made the products because she wanted safe stuff for her family. She's certified B Corporation. They're certified sustainable. So I love everything about them. They're female run. And the toothpaste is very minty. They have strawberry for kids too. There's a charcoal one also, but you'll feel really refreshed. And it doesn't have sodium lauryl sulfate in it, but it does have some foaming agents. So you definitely feel clean afterwards. And the clean is sustained. The other really good one that I love is Fossident toothpaste tablets from Daily Dental Cares. That is a product that is the best thing on the market that I found that fights tooth decay. So anyone that has an issue with tooth decay, I tell them to get it.
Okay.
They're toothpaste tablets, so I like it because it's less plastic. But you take one or two bites into these tablets and it effervesces everywhere over the mouth. It's the only natural toothpaste that I've known to do this. And again, you'll feel clean for the entire day afterwards. So Fossident through Daily Dental Cares or Wellness. Those are my two favorites. There's lots of other great ones on the market, but just don't use any mainstream ones that have a toxic label on them.
Got it. Okay. Well, the next question is from Sarah. It's about lipstick. And our question is, I wear a lot of lipsticks, sometimes plumping kinds. Sometimes they have the long-lasting dyes. I love how they look, but now that I've been hearing Dr. Amy talk with Dr. Lee about oral health, I'm wondering if my lipstick could be part of the reason we're having trouble trying to conceive, or is it just time for the full tushy check? So what do you think about lipstick and oral health?
Yeah, I'm not aware of anything that could really damage it. When we think about things damaging oral health, we're thinking about like inoculation, right, from another source. So your partner, your environment, picking it up from other people. I'm thinking about using harsh oral health care products that contain alcohol, or drinking alcohol is actually really bad for the microbiome too, because it's wiping everything out. So when we think about microbiome and health, we really want to make sure bacteria are balanced, that we keep systemic inflammation low. That way the body can accept an embryo and carry a pregnancy. So I wouldn't really worry too much about, the lipstick. I would get the tissue check for sure.
Okay.
And the saliva test.
So my mom and my sister, they never watch anything that I do, so they're not going to be mad that I call them out on this. They always use straws in everything.
Yeah.
Straws when they drink alcohol. Well, my mom. Straws when they drink their coffee. So is that actually better for your oral microbiome to do that?
You know, I could see how it kind of does bypass some of the oral cavities. You're not swishing it all the way around. I would say it's like better for your overall teeth, right? Because you're not getting acid and things and sugars and things like that on the teeth. So when we think about straws, we usually think about protecting the teeth more than anything. But yeah, I'm sure. I think it probably does positively affect the microbiome in some ways.
Okay, so my mom's always handing me a straw, so maybe I should take her up on
Yeah,
it. Okay.
yeah,
So,
not a bad idea.
so the next question is from Michelle in London, 35. I have autoimmune thyroid disease, and my dentist says I have dry mouth that's damaging my enamel. Could these things be linked, and could they also tie into my fertility struggles?
Yeah, so I can definitely say that they link to oral health for sure. So anytime that we have any sort of autoimmune disease, what we know is that the body got triggered in some way, and all of a sudden now it's attacking itself. And so the body is essentially on fire. And so we have to find any source of inflammation, whether it's from oral microbiome, whether it's from root canal abscesses, or cavities, maybe it's from toxins, molds, parasites, subclinical Lyme, whatever it is, we need to figure out what has triggered the body to turn on itself. Because when, you know, fertility, and you can speak to this, you got to have a quiet body in order for the uterus to work. The body's not going to receive an embryo and a pregnancy when you're in fight or flight. It's just not going to happen. And when you have something like an autoimmune disease, it does attack the salivary glands. And so we do get a reduction in the production of saliva in the mouth. And that really only exacerbates symptoms because the drier the mouth, the stickier the surfaces, and the more that the bacteria that we don't want colonize and thrive.
Got it. Okay, next question. Now someone is throwing their husband under the bus. Molly, 34 from Toledo, is saying, my husband has terrible issues with his teeth and can't stand going to the dentist. One time he broke the arm off the dentist chair during a cleaning because he was holding it so tight. He had a tooth infection that was treated with antibiotics, and the dentist said that he needs a cavity filled. He's been ignoring it for years. What is this doing to him and his sperm, and what might it be doing to me? How do we deal with this?
Yeah. So I would say, first off, it's very common for men to react this way. There's a reason why women have babies, right? And so there are lots of dentists out there that will do IV sedation. And so for patients that are really nervous and their fear is keeping them from going to the dentist, you can find a sedation certified dentist that will see you and do an exam. Sometimes they'll even give you some anxiolytic medication before even coming in. So they can give you like a benzo or a triazolam or something just to get you through the door. Obviously, you got to have a companion at that point.
Right.
But then they can do all of the treatment typically under IV sedation in one visit. So that's definitely the way to go. Because yes, what's happening in the husband is definitely affecting you. We know that oral bacteria, specifically PG, affect the sperm. So it decreases sperm count, it changes their shape, making them not ideal for implantation, and it reduces their swimming ability. And then we also know infections in the mouth cause inflammation in the blood vessels, which contribute to erectile dysfunction. So it absolutely is contributing to a fertility issue, and they should see a sedation dentist to get that sorted.
I need to keep remembering this because when I see guys, obviously they're doing their tushy check and I'm looking at their sperm. I need to remember that
Yeah.
they need the TUSHY-D. They need to get the
TUSHY-D.
TUSHY. Okay. So get to the dentist. So this next question is from Megan, 29 from Philadelphia. I've had 2 miscarriages and now need IVF. I also grind my teeth so badly my jaw aches. Could the stress I'm carrying in my mouth have any effect on my fertility? What do you think?
Well, stress for sure, right? Like I had my own fertility struggles and a lot of it was related to stress, but I would have airway checked. So oftentimes teeth grinding is the first symptom that we see when we have an underlying airway issue. So anyone that comes to me that says, I have TMJ or I have migraines, you know, can you Botox, like something like that? I need a night guard. I say, before we do any of this, I need to get an airway test because I can almost guarantee that you have an airway issue. Because what happens at night when your airway collapses, it's like a hose. It's like a hose, right? So when your airway collapses, it gets pinched. So we start to grind our jaw forward to open up the airway. And so grinding is often the first symptom that we see of an airway disordered breathing. Same with acid reflux. If someone has acid reflux and they've been on PPIs forever, which we know is terrible for our stomach and, you know, can lead to cancer, it's usually airway. So I would check airway.
Okay, great. Next one, Emily, 31, Dallas. I have PCOS and struggle with gum inflammation. Is there any link between the two, or could my hormones be making my mouth worse?
Both. So it's a bidirectional relationship with PCOS. So what we know is that the PG and FN bacteria in the mouth definitely affect hormone production and systemic inflammation, which can exacerbate PCOS. And then we know with PCOS and we have increase in testosterone, that can also lead to exacerbation of gum inflammation in the mouth. So PCOS is definitely bidirectional. But what I tell patients is if you have PCOS or endometriosis, we absolutely have to test your saliva, figure it out, and at least remove the oral component of bacteria getting into the bloodstream and inflammation, because they'll definitely be able to better control their PCOS if we do that.
Great, thank you for that. Next question, Lauren, 34, from Chicago. I was recently diagnosed with unexplained infertility, but I've also had recurring gum disease. Could there be a hidden connection?
Totally. FN. Yep.
FN.
FN all the way. Yeah, that FN bacteria. FN bacteria. So FN and PG. So FN bacteria is related to adverse pregnancy outcomes. So if someone is having like a ton of miscarriages, stillbirths, which really doesn't happen that often anymore, but that's usually related to FN. FN is tied to 64% of endometriosis cases. And then PG is if someone's having trouble ovulating, it's typically a PG issue.
Okay. Next question from Jessica in Portland. I'm embarrassed to admit this, but I've avoided the dentist for years. Now I'm about to do IVF and I think I might have a cavity or even an infection, and I'm scared that treatment could delay things. What's the safest way to handle this?
Go do it now. And you're not alone. So many people avoid the dentist. I would say the average time frame that I see for patients, is typically like on average 3 to 5 years, but many patients, like I just saw someone yesterday that had been 20 years since they've been in. So we're not everyone's favorite people. We're well aware of that. I would call the office and interview the front desk and tell them you're nervous about this. You've waited a long time. And if they're friendly and welcoming, and you get a good vibe, go in. If they're rude and you don't feel comfortable with them over the phone, don't go in. Yeah. But we're used to people not coming in and seeing us. But the best time to do it is now, because things only get worse when you're pregnant. Mm-hmm. When you're pregnant, your blood volume, I think, doubles. And with the hormones, our blood vessels become super leaky. And so what happens is if you have any kind of dysbiosis or issue going on in the mouth, our blood vessels and tissues become even more permeable. And so what's in the mouth, more of it gets into the body. And so it's even more damaging for the female reproductive tract when you're pregnant. So do it now. Do it now. Do it now. And it's also like, yes, we can do treatment when you're pregnant, but it's always the safest, right? If we can do it before you're pregnant.
Yeah, I agree. So Chloe, 27, from Miami, asks, I get constant canker sores and mouth ulcers, and I've also been diagnosed with low AMH. Could these two be connected in some way, or are they just bad luck happening at the same time?
So I would check systemic inflammatory levels. So when we see a lot of canker sores in the mouth, I always want to check for Crohn's and IBS. And then and leaky gut, and then I want to check for food sensitivities. So oftentimes canker sores in the mouth are related to gut issues. So I would recommend doing a gut workup to seeing if it's something there. But anytime you have a leaky gut, right, the gums are actually made out of the same material that your gut's made out of. It's just the gut's one layer, and the gums are multiple, but it's the same material. And so if the gut's breaking down, the mouth is breaking down. So oftentimes the mouth will mirror what's going on in the gut, which means that if we're having a bunch of canker sores, we probably have systemic inflammation going on. So there's a great test that people can take called the Rantes test, RANTES. That's a really good test for systemic inflammation. So I would have that checked and see if there's something going on.
Okay, great. And I imagine some people are listening to this and like, oh my God, Dr. Katie Lee is so smart. Can you just give a plug for us? Like, where can people find you if they want to work with you?
Sure. So I am at Centennial, Colorado at the Collective Health Society. So they can go to www.collectivehealthsociety.com. They can book a virtual appointment with me there. They can get saliva tests there as well. And then they can find me on Instagram at Katie Lee DDS.
Beautiful. Okay, next question is from Priya in San Diego. My fertility doctor says inflammation might be a part of my infertility. I have recurring bleeding gums. Is it possible the same inflammation in my mouth is hurting my chances?
100%.
Okay.
Yeah, 100%. Yeah, do a microbiome test. And what I love about these microbiome tests is they're easy, they're affordable, they don't hurt, we're not poking you, we're not prodding you, and the treatment's really easy. So there's different types of cleanings that we can do. And what's important to note is that out of the 754 plus bacteria in the mouth, less than 1% cause an issue, but half of those don't respond to cleaning. So even if you do a microbiome test and your dentist says, oh, we just need to do a deep cleaning, chances are half the bacteria showing up in those tests that are a problem, especially the ones that affect fertility, aren't treated by a traditional cleaning. So you got to make sure that you're seeing the right kind of doctor that can do adjunctive therapies such as tissue lasers. I love ozone, ozone water, ozone gas. We do ozonated olive oil, ozone insufflation, and then we have a bunch of supplements that we recommend to protect the mouth and the gut that people can stay on even during pregnancy. They're safe. So you got to make sure you're seeing the right doc to get treatment also.
Yeah. Yeah. Next question is from Rachel in Seattle, 33. I have endometriosis and I need IVF, but I'm worried because I've had cavities that keep coming back no matter what I do. Is there a chance my oral health is affecting my fertility?
So endometriosis, as I mentioned before, there's a great study that came out. 64% of lesions in endometriosis patients had oral FN present compared to 7% of lesions that did not. So if someone's suffering from endometriosis, they should get a salivary microbiome test because it's probably linked to that. And then cavities are a different cause. So cavities are caused by a specific type of bacteria. And there's a really great protocol that you can do to get rid of cavities. And so that's going to include, number one, seeing if the patient is deficient in minerals or vitamins. There's certain fat-soluble vitamins that we have to take in order to keep our teeth strong. We always want to make sure that we're putting minerals into our body because our food supply is very deficient in nutrition. And then lastly, I can't recommend Fossident enough. It's the best hack that I've found, and it's double-blind research based to prevent tooth decay. So I tell people to get the lozenges, and then every time you eat, pop a mint, and it will kill the bacteria causing tooth decay and neutralize your saliva. That way you're not getting any more cavities. So all of those things together will help.
By any chance, do you have these products on your website?
I need to put them on my website. They're in my office, but I will get them on my website. That's a great idea.
We'll try and put them in the show notes. We'll make sure that we transcribe this with an article, and then we'll include them all there for folks.
That'd be great.
Okay, so next question is from Olivia in Toronto. I've been told I have diminished ovarian reserve, and at the same time, my dentist says I have bone loss around my teeth. Could that be a clue that there's a bigger systemic issue?
Totally. So bone loss in the mouth indicates oral microbiome dysbiosis, and it also indicates systemic inflammation. So when people have gum disease, which is bone loss, or bleeding gums can happen with or without bone loss. So it can be gingivitis, which is just gums, or gingivitis with bone loss, which is gum disease. Regardless, it means the gum tissue is broken down and the bacteria are getting from the mouth into the body because the gums are supposed to be a physical barrier. So in either case, we know that there's an oral systemic component here. What we also measure in our office is an enzyme that is called MMP8. MMP8 is released from our neutrophils, and neutrophils are part of our white blood cells, so our immune system, and those are released in response to infection or inflammation. And so when that enzyme is high, we know that the patient is currently losing gum and bone in their mouth, but they're also losing collagen in their gut lining and in their joints. So we always test patients for this because sometimes I have patients that have a microbiome issue, a bacterial infection that I need to treat. Sometimes the bacteria are fine, but I have elevated MMP8, which then I know I have an overactive immune system and inflammatory issue that I need to treat. And some patients have both. So absolutely, if there's AMH and we have bone loss, I would test both MMP8 and microbiome to see which it is and then treat it because yes, it's affecting fertility.
Great, thank you for that. See, this is stuff I don't know. They don't teach me this in baby.
They don't teach dentists this either in school, so this is all new stuff.
Yeah. Next question from Kayla in Denver. I'm supposed to start IVF next month, but my gums bleed almost every time I floss. Is it better to fix that before starting, or can I treat it while I'm doing my fertility meds?
So Kayla, I'm in Centennial. Come see me. We can get you treated. It's always better to do it before, which I've been through IVF 6 times. So I understand the implication of telling a woman she only wants a baby that she has to wait. So I get that. But it's always better because there are several studies out there showing that oral microbiome dysbiosis and gum disease actually decreases the success of IVF treatments. It takes, I think, correct me if I'm wrong, around 3 months for eggs to mature.
Mhm.
It's best to get the treatment and, wait 3 months. If you can wait 30 days, that's great. If you can do 3 months, it's even better. However, I fully understand like there's a psychological and emotional component to this. So there is great research out there though that looked at women who had gum disease and they received periodontal treatment during their second trimester, and their risks of preterm birth, adverse pregnancy outcomes such as preeclampsia, gestational diabetes, and preterm labor went back to the same levels as if they didn't have gum disease, just getting treated in second trimester. So anytime is good. Get it treated. I prefer before, but it's going to be helpful no matter what we do. In our clinic, we do IV therapy as well. So anytime that we do periodontal treatment, I always have people hooked up to detoxification IV. So I use glutathione, alpha lipoic acid, and vitamin C, because we know that just doing a dental cleaning increases the bacteria from the mouth entering the bloodstream by 36 to 75%.
Wow.
So we are flooding the body, and this isn't just me, this is every dentist.
Right.
We're flooding the body with bacteria. This is why some people have to take pre-medication before coming in if they have artificial joints. And so for me, I don't want my patients, especially if they're doing fertility treatment, to have this bacteria lingering in their body. So we will give them an IV at the same time in one arm, and then the other arm, we actually give them an immune boosting IV to help boost their immune system. So we have kind of ways around that. But either way, get it treated.
And then for folks who, let's say, haven't seen the dentist for 10 years, are you flooding their system even more with bacteria because it's been so long?
So everyone's microbiome is different. Like one of the patients that I just saw that hadn't been in 20 years, her actually microbiome was great. We tested her and it wasn't too bad. So, I mean, I see, and I saw one patient today that's been seeing a functional provider and was having gut issues. So she referred her to me. She just had a cleaning 3 months ago and she probably had the worst microbiome profile I'd ever seen. And she was like, I see my dentist every 6 months and they say everything is fine. So you don't know unless you test.
Got it. Okay. So hard to just see. You can't just look at someone and just know.
I mean, sometimes you can, but it could be inflammatory, right? If I see a lot of bleeding gums, it could be just inflammation or it could be hormonal. It's not always bacterial.
Got it. Okay. So this next question comes from Aisha, 26 in Atlanta. I don't eat much sugar, but I still get cavities and gum sensitivity. I've also been told I might have endometriosis. Could my oral bacteria be tied to what's happening in my reproductive system?
Yeah. So FN and endometriosis for sure. Get it checked. And then the cavity thing, yes, I hear this all the time from patients. I don't eat sugar. Why am I getting cavities? Part of it is the fat soluble vitamins. So we need to make sure that our vitamin profile is great. We need to make sure that patients are getting minerals. So I love putting minerals in my water. You can just do like Himalayan sea salt, put it in your water, or buy some minerals, dump it in your water as you're drinking it. That will help. But what people don't realize is a lot of processed carbohydrates are actually worse for our teeth than sugar. So think breads, cracker, even the healthy crackers, almond crackers, pretzels, anything that's kind of breadish that will stick to the teeth is bad. But another really huge one that people don't realize is frequency of eating. And this is what used to get me because I've always been a grazer. I've never been a big meal person. I just kind of snack all day long. And I always had cavities. So when you get tooth decay, it's because you have a specific bacteria that causes decay. They have a food source, so some sort of carbohydrate, and then you have acid. So every time you eat, the pH in your mouth drops. The acidic area or acidic environment in your mouth is prime time for the bacteria to digest the carbohydrates and excrete acid on the teeth, and then your teeth demineralize. So if you decrease the frequency that you eat, oftentimes that will help solve the cavity problem.
Oh, good to know. Great to know. So that's it for all the questions that were sent in. Thank you everyone for sending your questions. There have been a couple questions that have been added as we've been talking, and I just want to go through them and see if we can ask Dr. Katie Lee, because she is an expert in all things oral health and fertility together, like I mean, I feel so
I
lucky
wouldn't
to be
say
diverse.
expert. I would just say passionate and had a lot of experience with it.
Well, more experienced than me, more expert than me. So this question, my dentist saw white lines in my mouth, but I've had 2 biopsies and nothing serious came up. Can regular sea salt be okay? I'm not sure if that's all part of the same question. They're from the same person, but I guess it's a good question. Like, does sea salt or this type of salt you pick impact your oral health at all?
So I would do healthy salt. So make sure it's in a really high quality organic Himalayan sea salt. There have been some, and I'm not a nutrition expert by any means, but there have been some articles that I've read out about Himalayan salt being really contaminated with metals and stuff. So be careful your source. I love real salt. That's just what I get, but just make sure it's a high quality salt. In terms of the lines on the mouth, sometimes that can be like a linear alba, like on your cheeks and it could be a sign or symptom of grinding in the middle of the night. You're kind of biting your cheek. So again, check airway if that's it. It could also be, depending if it's not that, it could be something like a lichen planus, which is usually autoimmune. So I would have that checked.
Okay. And I think you just answered the questions that she just also asked right now, too. Next question is, do you like dry, loose clay powder to gargle with water to pull out all the bacteria?
I don't because it's gross, but it's certainly great. So if it works for you and you like it, go for it. I think they're probably talking about like bentonite clay or something like that. Totally fine to do. I think it's fine. I just think it's gross, so I don't do it. But yeah.
That's
People
funny
have,
to
I
say
mean,
that.
people usually, I have patients that come from all over the country to see me. They
Yeah.
educate me with all kinds of stuff that they do that
Right.
I've never heard of. So I think the clay is great for pulling out toxins and stuff. I think it's fine to do.
Yeah.
It's better than Listerine, I'll tell you that.
Right.
So
Okay, excellent. Well, thank you, Katie, for joining us today. For those
you're
of
welcome.
you who want to find her, it's katieleedds.com. A big thank you for sharing your wisdom with us. And if you want to connect with her, you can find her on Instagram at KatieLeeDDS and at her website, katieleedds.com.
Thank you so very much.
I appreciate your help. Thank you for answering all our great
You're
questions today.
welcome.
Appreciate it.
All right.
Take
Have
care.
a good day.
Bye.
Bye.
You too. Bye-bye.